Welcome back, business crew, to the second part of this investigation into COVID-19 Australia in Crisis podcast series on the Business Crew channel. My name is Peter Solanico and I'm a business consultant, mentor and coach, and I am here to present my findings into this virus, and my incentive for doing so is to be better able to get a feel for the way that the economy is functioning, what the future for the economy holds, how it's going to impact businesses now and in the future. And in doing so, I have undertaken quite a lot of research into this area. In the meantime, I know that this is something that is of concern to many other people for a variety of reasons. Could be for economic reasons, could be for health reasons, and that's why I have decided to create a podcast series into this matter. And because it is a complex issue, it's a very serious issue, I want to present my findings, and there's quite a lot of them, into a variety of areas into this situation. Unfortunately, the situation is bad. My findings are, well, for most people they will not be good, and this podcast is now going to be focusing on the conspiracy theorists that are involved in this case, the role of the media, the government, and the conclusion is, my friends, that we are all alone. Don't expect help, don't expect support, don't expect guidance. It is now every man for themselves. So all I can say to you is good luck. May the strong, may the smart survive. And if you continue to listen to this podcast, you'll know exactly what I am talking about.
If you believe in what you do, anything you want will come to you.
Before we start, I want to get you a little bit into the mood of what is going to be presented in this podcast. And I want to do that by playing a game with you. Let's play the pretending game. Let's pretend that we are on a very large ship 1,000 kilometers from the nearest inhabited island. Let's pretend that that ship has hit a reef or hit some kind of rock and is taking water on board very quickly. And let's pretend that we know that because it's official, because that has been announced by the captain and the crew. And then there are two people. There's me and then there's you. Now, I've done a little bit of research over the past few days around the ship, meaning I've snooped around, I've sort of checked the ship out. Let's assume that I know a little bit about geography, and I know pretty much where we are, and I know pretty much that we are very far away from land. And let's just say that we also know that this ship is almost full. It's got a capacity of 3,000 people, but what I've noticed is that the life rafts can probably take about 1,000 people. And I am presenting this case to you, and I'm saying, look, oh man, I think we've got a really, really big problem here because, well, the ship, as we know, it's taking on water. We're 1,000 kilometers away from the nearest inhabited land. The ship is sinking. Oh my God, what are we going to do? We've got these lifeboats, and there's only about room for about 1,000 people, so a lot of us aren't even going to be able to get in there. And the other thing is, as far as I can see, there's a really, really, really big storm brewing. It looks like it could be a little bit of a hurricane. Even those people who are going to get into those boats, how the hell are they going to survive, being transported 1,500 or whatever kilometers to safety? Oh man, what the hell, what are we going to do? Oh goodness. And then you say to me, you're a bit of a worrywart, you're a fearmonger, you're a scaremonger. Yes, I have been particularly negative in this scenario, but my question to you, business crew. Am I a scaremonger? Am I a worrywart? Or am I just presenting the pretty dramatic and pretty scary situation as is? And at the end of the day, we are literally in the same boat together. So what is your problem that you are throwing such descriptive words at me when it's also in your interest to know what the situation is, regardless of how bad the situation actually is? Why have an issue with me because I'm being negative about a really negative situation? You faggot, you Nazi, you're a scaremonger, you're a racist, you're a sexist, you're a fearmonger, you deal in pessimism porn, you're a conspiracy theorist. We often hear these words, and it's very easy to throw words like that around at people. But in many cases, the people who are throwing these words around don't actually know what they mean. So now I want to shift the focus a little bit and talk about conspiracy theorists and conspiracy theories. A conspiracy theory is an explanation for an event or situation that invokes a conspiracy by sinister and powerful groups, often political in motivation, when other explanations are more probable. The term has a negative connotation, implying that the appeal to a conspiracy is based on prejudice and insufficient evidence. Conspiracy theories resist falsification and are reinforced by circular reasoning. Both evidence against the conspiracy and an absence of evidence for it are reinterpreted as evidence of its truth, whereby the conspiracy becomes a matter of faith rather than something that can be proved or disproved. I have found an article titled "Conspiracy Theorists Destroy a Rational Society, Resist Them." Its author is John Thornhill. It was written on January the 15th, 2021 in the Financial Times. I'm just going to take a couple of extracts of the article which provide a little bit of information about conspiracy theorists, not theory, theorists. Here is one paragraph. Few things in life are more tiresome than engaging with cranks who refuse to accept evidence that disproves their conspiratorial beliefs. Even if violence is not the recommended response, it might be easier to dismiss such conspiracy theorists as harmless eccentrics. But while that is tempting, it is in many cases wrong. Next paragraph. As we have seen during the Covid-19 pandemic and in the mob assault on the US Congress last week, conspiracy theorists can infect the real world with lethal effect. So I want you to think about what I have said there. I want you to think about the definition of conspiracy theories. I want you to think about the characteristics of conspiracy theorists. And I want you to think about COVID-19 and the coronavirus. And I want you to now conclude, who do you think is a really good example of a conspiracy theorist? Now I have some really bad news, really sad news, but more importantly, really scary news. Based on both the definitions and based on the evidence that I've accumulated over the past 1 year, we have a problem. Australia, we have a problem. The conspiracy theorists in this case are our leaders. It is the government, it is these medical experts, it is the leaders in many fields that are responsible for making policy decisions and developing policies in response to the COVID-19 virus. Unfortunately, I can prove this. And that's the scary part. Because if our leaders, the people who have a lot of power and influence over our lives, who create laws and regulations which affect us, affect our movements, affect our way of life, our quality of life, will influence what we think, how we think. If these people, if they are conspiracy theorists, if they are in effect delusional, then we've got a major problem. And for the first time in my 47-year life, I have never been in such a situation. And generally, in the past, I have been very positive, and I tended to not criticize the Australian government because I understand that it's a tough role and a lot of decisions need to be made on various aspects of our economy, of our country, of society, and so there will be things which obviously I disagree with, and nobody will agree 100% with every single stance that the government takes, or a policy, or every single view that a government holds. But by and large, the Australian government, the Australian leadership has actually been quite competent, has been very, very proactive, which is why Australia has the standard of living and is in the position that it's in because it's a reflection of the leadership. But in this case, over the past 1 year, with the pandemic, oh man, this is just completely out of control. And for the first time since I've become a thinking individual, I'm not going to say since, when I was 3 or 4 or 6 years old, but in my adult life, it's pretty much every man for himself. By and large, Australians have tended to be quite loyal to the leadership. We can no longer rely on the government, and to explain this in more detail, I really need to get into COVID-19. And I need to then discuss the way that the government has dealt with COVID-19 to show you that it's completely wrong. And what they have been projecting to us about COVID-19 is extremely disproportionate, and it really does stretch the truth and the facts to an extreme, to the point where, in many cases, as with conspiracy theories, there's a lot that are just not based on facts. To prove to you that our leaders are conspiracy theorists and that we can no longer rely on them to be our guides and our saviors, we need to go back to the basics of COVID-19 to learn a little bit more about it. So, very basically, COVID-19 is not a very dangerous respiratory virus for most people. In fact, quite a lot is already known about COVID-19 because of the fact that it is part of the coronavirus family, which, as I mentioned in the previous podcast, has been around since 1935. The coronavirus was actually discovered in 1935, so it has been studied, it has been analyzed, it is quite well known. A lot has been written about it in academic journals, in medical journals. It is nothing new. Coronavirus is not new. In fact, the most well-known strands of coronavirus, which you probably would have heard about yourself, would be MERS, SARS, and now COVID-19. So these have been with us on and off for a while now. So keeping this in mind, there is really no excuse for creating a panic, because it's not something that's unknown, that has just appeared out of nowhere. What really needs to be done is to look at the previous findings into this area and then to make certain adjustments to the knowledge based on the fact that this is a new strain. So really, 70 or 80 or 90% of the information is already relevant, which is the coronavirus part of the COVID-19 aspect of it. And then we've got that missing 10%, which obviously needs to be investigated, analyzed, and researched to find out the specifics of what implication that has on society. That's issue number one. And probably you didn't know that COVID-19 is part of the coronavirus, which was discovered in 1935. So that's already very important. That is incredibly important. We are dealing with a strand of a virus that is well known. Okay? That should have been provided as information at some period of time, over the past year, because we certainly know about it. Number two, COVID-19 is actually an incredibly weak virus. Again, please don't try to read between the lines and think that I'm meaning something that I'm not. I'm specific here. It is an incredibly weak virus, which is different to being an incredibly contagious virus. Yes, COVID-19 is an incredibly contagious virus. It spreads from individual to individual very easily. In fact, that's one of the issues which I'm going to discuss later down the track, which is actually sickening, the way that the government has approached this, knowing that it's such an incredibly contagious virus. And it's a contagious virus because it's an airborne virus. It gets passed around through particles in the air. And that's why we are told to wear masks, because as we speak, as we sneeze, as we talk, as we yell, if we are infected, these little particles are then spread around. But what is not told to us is that the spreading is done in a wide variety of ways. It's not a matter of we wear a mask and we don't shake each other's hand and then we'll all be safe. Now that's not quite how it works. Again, it's a little bit more complicated than that. When we talk, when we breathe, we exhale, and these particles float through the air. The particles land on hand railings, on products in supermarkets, land on tables and chairs, land on the floor. They settle on surfaces that are around the individual who has the actual virus itself. So if the government really wants us not to get infected, they basically should tell us just to completely shut up and not talk to anybody, and almost pretty much not to exhale. Now, quite clearly that's just not realistic, but that's the reality of the situation. I'm going to give you more information about how weak this virus is. The virus is incredibly weak. Without going into too much detail, because it's not important, but think of it as a tennis ball with an outer casing, and the outer casing is what actually attaches to our organs and then enters our system. That outer casing, which is like a protective surface of the virus, which is actually inside, it's a fatty substance, and the implication of that is that you can actually destroy that and render the virus ineffective by destroying the casing just through using soap. And that's not something that is used to render many other very lethal viruses, where soap is not enough. Many germs are not killed by soap alone, hence you've got things like bleaches and strong chemicals and so forth. In this case, we don't even need that. That is known. It's not that as a business consultant who has no background in medicine, I have found this incredible discovery. It is widely known. If I have found out about it through reading medical journals and research journals in this area, then I'm sure that there are others who provide information and research and findings to the government will also provide that. Yet we are forced to provide hand sanitizer to help protect the spread of this virus, which often has a minimal alcohol requirement of 70% in it. This is not based on scientific evidence. You don't need 70% ethanol or 70% alcohol hand sanitizer to combat this virus. It's simply false. You don't need that. You need soap. As a minimum, you need soap. So that's number one. So that's going back to conspiracy theories. They are making this virus more lethal than it is. And we are being forced, with the threat of punishment of fines, that we need to provide the public, if we are running a business, we need to provide the public with hand sanitizer with a minimum, which is a very high amount of ethanol or alcohol in it, which again is not based on fact. Another thing, most people don't even know that they've got the virus. How lethal can the virus be? If most people have to have a test to work out whether they actually have the virus or not. Well, think about it. I mean, a virus is lethal if you're ringing around in pain, if you have, major issues, if you've got major problems. You don't need to have a test to know that something's going on, because you basically can't move, you're in pain, you're writhing, you're frothing at the mouth, you're having convulsions. You don't need a test. In this case, you could be walking around, running around, you could be living a normal life, then you're being told to have a test. You do have a test and you think, oh, wow, you've got coronavirus. Jesus, I didn't even know that. So there's a lot of people in that case, they actually have no clues that they have this virus because they have absolutely no symptoms. And then you've got quite a large number of people who have very, very minor symptoms. Sniffles, coughs, colds, maybe a bit of a headache. In fact, you've probably seen on the news Gladys Berejiklian, who I think she coughed or she had a dry throat. They asked her, like they grilled her about not taking a coronavirus. It's sick. You, like Gladys Berejiklian, you theoretically cannot cough without not taking a test, because that could be a potential symptom. So in other words, we've got people who are healthy, who have a dry throat because they've been talking or yelling or screaming or whatever, and yet they could possibly have coronavirus, or possibly not. That's a thing we don't know. We need to get tested. And this is the virus that has caused a lockdown to occur. It has caused the crashing of economies around the world. It has paralyzed our tourism industry. It has closed our borders. Once again, this is not based on reality. It's not based on facts. This is madness. This is absurd. Yes, it's true that the virus does kill a specific segment of the population. It's not even old people. Initially, when I first began to investigate this virus, we're talking, very early last year, look, it kind of was fairly clear that this is a virus that affects old people. That's not even true. It affects a certain segment of old people. So it doesn't even affect that specific segment as a whole. It affects a sub-segment of that specific segment. It basically affects, or it's a threat to, those people who already have some kind of medical problems, particularly respiratory problems, or if your immune system is quite weak. Now, the reason why old people tend to be more susceptible to COVID-19 is because as you get older, your body degenerates just over time, just naturally. So you will have weaker lungs, so you will have a weaker immune system, so you will have a weaker this, you will have a weaker that, you will have problems here, you'll have problems there, parts of your organs won't function as they should, and so forth. But if you are one of those older people who are actually quite healthy, because obviously not everybody is physically falling apart as they get considerably older, but that just generally happens, then you're actually going to be safe. So this is a virus that is of a particular threat to people who are quite sickly anyway, which is why most young people have not been affected, because most young people are generally quite healthy. Yes, you will hear the occasional person, who's in their 30s or 40s or 20s dying. Yeah, but this person could have been somebody who already was quite sick. I mean, you get specific cases just in general anyway. There are extreme cases of people being allergic to, for example, to the sun or just to normal germs. I mean, these are extreme cases. You might, this is one in 10 or 20 or 50 million. But that doesn't automatically mean that the sun is dangerous and it's going to kill you, because you can pull out 2 or 5 or 10 or 20 examples. Now, with COVID-19, obviously you can pull out more than 10, 20, 50 or 100 examples, yes. But it's not the pandemic that people thought it was going to be. Remember right at the beginning, when this all started, remember the rumours that the hospitals are going to be inundated, that the world's population is going to be reduced by 10 or 20 or whatever, 30%, hundreds of millions of people are going to be dying. Remember that. That was the initial reaction. It was a panic, a total panic. Economies were locked down and so forth. Whilst the amount of infections certainly were quite large, the reality is that the proportions of deaths is actually incredibly small. But it goes further than that. It goes a lot further than that. The statistics of cases to deaths are publicly available, and they get updated hourly, I think, for the various countries. So on the 23rd of February, which is today, if you look at the statistics, and I'm using the website worldometers.info/coronavirus, so worldometer.info/coronavirus, but you can just type in coronavirus death statistics or coronavirus cases statistics, something like that. The website will show up. February 23rd, 2021, we have had, since the start, 112,360,167 cases. Of these, the number of deaths has been 2,487,501. So we have had roughly 2.5 million worldwide deaths from almost 112.5 million cases. This data, which again, it just shows that the proportion of deaths is less. It's about 2%. 2% of cases have ended up with deaths. 2.5%. Well, less actually. It's about 2%, but it's a lot lower than that. I guarantee you it's a lot lower than that. And this is my speculation, but my speculation is based on critical thinking, common sense, because the 112,360,167 cases are based on measured and identified cases. The people, and there would be millions and millions of people around the world, for one reason or another, would not have had a coronavirus test at the time when they could have possibly had the coronavirus. They could have been infected. Like myself, for example, I have never been tested for coronavirus. Have I had it? I don't know. Maybe. And there are going to be situations where people have been tested, and they, for example, when they have been tested, they might not have been at that time infected with coronavirus, but they may have been infected with coronaviruses at other times where they didn't even know and they weren't tested at that case. Then you might have situations in countries where people who have had the coronavirus, but they just haven't had the opportunity to get tested, or the facilities for testing weren't there. In other words, the number of cases that we are looking at here, I know that they are going to be understated, well understated, because you cannot have a case unless that case has been proven to have occurred, which you need to be tested for. But there are going to be lots and lots of people who have not been tested for COVID-19. And secondly, if they have been tested for COVID-19, that doesn't necessarily mean that they never had COVID-19, even though at that particular point in time, they have tested negative. So 112,360,167, that could actually be 200 million cases, really, perhaps. Now let's look at the deaths. 2,487,501 deaths. There is a very high likelihood that is overstated. It certainly can't be understated, because that means that there are mystery deaths. There are dead people which we don't know about, that they've just collapsed somewhere in the middle of the desert or in the middle of the ocean, and they've just died and they've just disappeared, and we don't know about their deaths. Okay, well, we do know about their deaths, but there is an issue here in how the deaths are recorded. And there's a bit of a debate here. In fact, there's a criticism, even at the highest level, particularly in the US, about how the deaths are actually measured when it comes to the cause of the deaths. So we need to distinguish here between deaths caused by COVID-19 and deaths of people who have had COVID-19. And this makes a very, very big difference. Now, I have read about this in a number of journals, but I would just like to refer to Scientific American, because Scientific American, it just covered this issue or this topic quite well and quite simply and quite understandably for me. So Scientific American is certainly not the local bloke on Facebook or the local bloke at the pub. I'm sure that this information you can find in various other academic journals. So I'm not picking this one for any particular reason other than the fact that I found it as one of the publications, and the information presented here is actually quite easy to understand and quite easy to follow. So just let me read to you just so you can see my point. And the title, How COVID-19 Deaths Are Counted. That's the title. Assigning a cause of death is never straightforward, but data on excess deaths suggests coronavirus death tolls are likely an underestimate. And this has been prepared by Stephanie Pappas, Life Science, on May 19, 2020. So we're going back almost a year now. So even in those cases, where we had the euphoria about COVID-19, so that's already, been something of an issue. So I'm just going to read through some of this article for you, just so you can see what someone who specializes in the field needs to say. As coronavirus has swept through the United States, finding the true number of people who have been infected has been stymied due to a lack of testing. Now, official counts of coronavirus deaths are being challenged too. In Colorado, for example, a Republican state legislator has accused the state's public health department of falsely inflating COVID-19 deaths. In Florida, local media have objected to the State Department of Health's refusal to release medical examiner data to the public, alleging that the state may be underreporting deaths. The reality is that assigning a cause of death is not always straightforward, even pre-pandemic, and a patchwork of local rules and regulations makes getting a valid national data challenging. For COVID-19, the immediate cause of death might be listed as respiratory distress, with the second line reading due to COVID-19. Contributing factors such as heart disease, diabetes, or high blood pressure would then be listed further down. Thus, this has led to some confusion by people arguing that the real cause of death was heart disease or diabetes. Without the COVID-19 being the last straw or the thing that led to the chain of events that led to the death, they probably wouldn't have died. How hard it is to accurately determine whether COVID-19 was truly that last straw depends on the situation. Most COVID-19 deaths seen at Mount Sinai Health System in New York are in people who have comorbid or co-occurring conditions such as coronary artery disease or kidney disease, said Dr. Mary Folks, the chief of autopsy services at Mount Sinai. The challenge is knowing who died of COVID-19 versus who died with the virus that causes COVID-19. Autopsies can help answer that question, but autopsy rates were low even pre-pandemic. Even at Mount Sinai, a rare medical system that offers every family a chance to have their loved one autopsied for free, the rate of autopsy was only about 20% prior to the pandemic. Anyway, I could keep going and going, but the main point of this is that it is not that simple to work out which person has actually died because of COVID-19. Going back to a very simple example, we have seen in Australia many people dying who are in their 70s, 80s or 90s. These people do not live forever. If you're in your 70s, 80s, particularly 90s, then you could die today, tomorrow, you could die any day. Any day. Just because you have coincidentally been infected with COVID-19, you cannot assume that this individual would have lived for the next 5 or 7 years. Okay, so he died today, whereas it's very easy and very quick to label them as a COVID-19 death, but if they didn't have COVID-19, they could also have died, today or tomorrow or the next day. So, as you can see, the death toll, the official death toll resulting from COVID-19, most probably is going to be considerably inflated and overrepresent the deaths of people as a result of COVID-19. Whereas in contrast, the coronavirus cases, the 112,360,167 cases that are being reported globally, that could be potentially much, much, much lower than the real number of coronavirus infections globally. So if we inflate that official figure of cases a little bit, or in other words, if we assume that there are more people who have been infected with COVID-19, if we then look at and reduce the death rate and link that specifically back to the people who have died from COVID-19, we are looking at a virus that potentially kills 1 in 100 people who are infected by it, and then not just that, but people who are generally quite sickly and, well, unhealthy. That's still a lot of people. I agree, 1 in 100, a 1% death rate of an incredibly infectious virus. That's obviously not good. But what I'm saying is, does this require such a response that has a catastrophic impact throughout the whole economy? Does it warrant the panic, the fear-mongering, the misinformation, the job losses, the economic turmoil, the mental health problems, the family breakdowns, the family violence, the frustrations, the protests, the conflicts between police and citizens, the conflicts between citizens amongst themselves, the stranding of people overseas where Australian citizens cannot come back home, the bankrupting of large organisations, the bankrupting of small organisations. I don't think it does. I don't think that if you look at any other disease, any other problem, any other issue, like skin cancer. Imagine skin cancer. We know that kills. We know that. Everybody knows that the sun or exposure to the sun kills people. There's no panic over that. People aren't forced to wear sunglasses and cover themselves up whenever they go on the street. You don't get skin cancer marshals or skin cancer monitors walking around streets with sunglasses and hats and passing on sunglasses and hats to anybody that they see who's not wearing that. You don't get the government forcing stores to make available sunscreen with an SP factor of 50 available for their customers to put on as they leave the store in place of the current hand sanitizer. The government hasn't forced put roofs over parks and to put roofs on ovals and fields so people can play sport without having any exposure to the sun. I mean, that's just absurd. But that's basically when you think about what the hell has been happening as a result of COVID-19. It's just people can't touch each other, people can't stand next to each other. There are plastic screens which have been placed. There are hand sanitizers as you walk into stores. It's just amazing. It's just out of control. It is pretty much the same as forcing people to give out glasses and hats and not allowing people into stores who wear short-sleeved shirts, or the police fining people who are on the streets who are wearing short-sleeved shirts because they are going to be having an exposure to the sun, which means they could get skin cancer. Now you might be saying, if you're one of the smarter people, you might say, hey man, what are you talking about? Why are you making that comparison? Skin cancer isn't contagious. Yeah, no, it's not. I never said it is. But you can create a story around that. The government can actually make a story around that and say, well, because of people like you who are irresponsible, you are selfish, and you are walking around with short sleeves on, and you are and you are going to be getting skin cancer. They're not going to say you are risking, because they're a lot more alarmist with COVID than just saying, well, you might, there's a risk, whatever. It's like, we're all going to get it, everybody's going to die, we have to take action now, we have to close the economy, we have to lock everybody down, we have to put in a curfew, we have to protect it. That's like them saying to you, well, you have to wear long sleeve shirts because otherwise otherwise what's going to happen is you will get skin cancer, and so you're going to go into hospital, you're going to be utilizing resources, you're going to be taking up hospital beds which could be used for other people who would be needing those same beds, and you're going to be causing waiting times at hospitals for specialist treatments for people who suffer accidents or in car accidents, whatever, because of selfish people like you, because you want to get a bit of a tan, or because because you're a nut, because you're a nutcase, because you're a conspiracy theorist and you think that the sun is not going to cause skin cancer when it's proven that the sun does. So you're being selfish. You're more concerned about looking healthy and attractive and having a tan, you selfish individual, and so the police are going to fine you. So everybody now must, if they walk out the door, they now must have long pants on, they now must have long-sleeved shirts on. Because if you don't, you're going to get a fine. And you're going to get a fine because you're going to get skin cancer. And if you're going to get skin cancer, you're going to close the economy down because you're going to overwhelm our health services. And so that's going to have a flow-on effect to the rest of the economy because people won't be able to get health services. So it's all crazy. It's absolutely, it's just amazing. It's seriously, it is, if you think about it like this, it is amazing. So the example I'm giving you, it's an absurd example, and if anybody would say that to you, you would think that these guys are nuts, that these guys are conspiracy theorists, that they're actually nuts. Well, I'm telling you, with my understanding of COVID-19, with the fact that this virus is a threat to a small segment of our society, who already has issues with their health, it is a risk to that particular part. They have created this into a massive panic, into a massive pandemic. If you look at the statistics, even statistically using official data, the death rate is very small. And I have now just proved to you that data anyway makes this coronavirus look a lot more dangerous than it is, because it compares cases to deaths. And I'm telling you that the cases, I've told you that the cases are probably going to be a lot more higher, except people haven't been tested, and then the deaths are going to be considerably lower, because not everybody that has died with coronavirus has died as a result of the coronavirus. Okay, business crew. At this point, what I want to do is just take a little bit of a break and use this time for reflection and a review of what we have covered so far. Now, it's well over a year since COVID-19 has been with us, so there has been plenty of opportunity for the government and for all the health specialists and medical practitioners to make their point across about the COVID-19 virus. So my question to you is, and this is something that you should always also question yourself, with the information that I have presented, does this now make COVID-19 look a little bit different to you than the information that you have been provided by the government? Who is the conspiracy theorist here? Is it me, or is it the government? Now, the only similarity, or the only common denominator that I have with the definition of a conspiracy theorist, is that I am bringing the government into it and government efforts to create, let's just say, a conspiracy. That's about it. But certainly the information that I am presenting about COVID-19 is very, very close to factual. I acknowledge that it is an incredibly infectious respiratory disease. I also acknowledge that, yes, it is deadly. There is a segment of the community that is at risk, in fact, at a high risk. I also acknowledge that hygiene helps to combat the virus, which is an airborne virus, to kill off the particles, but I also do acknowledge a lot of other things. I acknowledge that we don't only need very high alcohol content or chemical based sanitizers to eliminate this virus. I acknowledge that we need soap to eliminate the threat of the virus. The government and the medical specialists, which we keep hearing about, seem to be focusing on the risk factors, seem to be focusing on the scary aspects of this virus, and not on the less scary components. The fact that soap is required to eliminate this virus. Now, if you make it obvious to the public that all you need is soap and you'll be fine, well, that makes this virus look a little bit more friendly than by claiming that you need special sanitizers which have a certain very high percentage of alcohol to be able to combat it. I acknowledge that this virus is deadly. Obviously, the government emphasizes that the virus is dead, but at the same time, I acknowledge that this is a very weak virus, and I provide a number of examples and a number of arguments why this is a weak virus. I have never ever heard anybody from the government say that this virus is weak. In fact, as far as the government is concerned, it seems that every single one of us is under a potential threat of this virus, which is not exactly in line with the findings. Now, it also makes a very big difference, I feel, into the perception of the virus if it has been acknowledged that whilst this virus is quite unique because it is a particular strain, but it's a particular strain of a virus family that has been around for over 80 years. That now will tell people, well, we do know a little bit about this, so in other words, it's not so weird and bizarre and unique and unusual as something that has just popped out of nowhere. The government has avoided to mention that at all, and again, I think that makes a big difference, because making it out that this is a completely new virus which has taken everybody by surprise, and in fact we have no idea how to tackle it, how to handle this virus, what to do, that is quite different. That provides a different perspective on the virus than if it was acknowledged that this is a virus of a particular family of viruses that is well known, well researched, quite well understood, but it's a different strain of that particular family of viruses, and as a result we just need to do some top-up research and investigation into this to be able to get a better understanding of it. That makes it a lot different to a innovative, new, completely different, out of the blue virus, which obviously, people would panic about. So please consider all this information. We have had well over 1 year for the government to make their point across. We have had well over a year for the government to be able to say everything that they need to say about this virus. And now maybe you have heard different things to what I have, but I certainly have not heard a lot of the information which I have brought up in this podcast so far, and that should tell you something. Well, it certainly tells me something, but maybe your situation is different. Maybe you have heard different spokesmen of the government. Maybe they have mentioned all these different things, and well, clearly I'm obviously wrong here. But let me know where you have heard this, because I'm actually curious to follow it up. Now, in terms of telling you stuff, I have purposely avoided to provide references and to provide examples of the information that I have provided in this podcast. Now, I have quoted definitions, I have provided information, health information and characteristics of this virus, and I have sourced this from somewhere. And I could have referenced it for you, but I have specifically not done that because I want you to do your own research. There is plenty of information in there that you can go on. I don't want to get to the position where I'm dealing with, let's just call them very diplomatically, very simple people who have a particular perspective on this, and regardless of what information you're going to throw at them, they're going to start criticizing it. So if I then said, look, this is the information where I got this from, this is the source, then people will obviously, once they look that source up, and they will see that is the information is presented there, then they may not attack the information that I'm presenting, but then they will attack the source. Well, what kind of magazine is this? What kind of journal is this? What is this website? What is this organization? So I don't want any of that. As I said at the beginning of the first podcast, I am independent here. I am just presenting the information that I have accumulated over a long period of time. There is plenty of information about this. I have stated this. COVID-19 is part of a virus family that is very well known, very well researched, very well studied over almost 1 century. There is plenty of information out there, and I'm not just talking about contemporary, very, very modern, over the past year or so information, because I am a little bit concerned that that might be tainted, because as you can sort of get the feeling here with the information I'm providing, COVID-19 has been politicized quite a lot. I have no idea why, and that's something that we can discuss later on, but there is plenty of information going back a year, 2 years, 3 years, 5 years, 10 years, 20 years, 30 years for you to be able to look into yourself. So it doesn't matter which source I have used to find out that you can use plain soap to get rid of this virus, to eliminate the danger of this virus. You will find that from 20 sources, 30, 50 different sources. In fact, you choose whichever source you find most credible, and that information is going to be there because it is a fact. As I said before, we are pretty much alone in this, well, crisis, really. We're not getting any honest assistance, support, information, guidance by the government. And now I want to discuss the role of the media. Overall, the message of the media, to me personally, has been nothing other than a joke. It's been very disappointing. The only exception that I have found is Sky News in Australia. The general message overall by the main media outlets is that, well, the vaccine is safe, everything is great, not a problem, we should all get the vaccine, the end of the coronavirus and COVID-19 is just around the corner. Almost like synchronized swimming. In this case, it's synchronized public relations, synchronized prosperity messages, which is great if it was based on facts. Unfortunately, it's not. Media tries to project themselves as being unbiased, showing both sides of the story, and I don't think that's happening. Whilst they're trying to convince us that that's what they're doing by asking apparently the really important questions in regards to the vaccine, they have been nothing but softball questions. I mean, ridiculous questions such as, how do you convince people that this vaccine is safe? And then you have somebody who has a vested interest in this basically saying, well, it's been tested thoroughly by professionals who know what they're doing, and there's been a lot of government support and a lot of money has been thrown at it, and it's undergone a very thorough process. It's been tested and double tested and so forth. And there was even a news brief that I saw which included questions from the audience. Again, just really wank questions such as, oh, I am really keen on getting the jab, but my auntie, who's a little bit older, is skeptical. What do I say to try to convince her? Just real softball questions. Not once has a question been asked such as, why is it that the vaccine, according to all these medical experts, is so safe? Why is it that the vaccine manufacturers have been exempt from potential claims made against them? That's a pretty important question. I think that's an incredibly important question. Another one is, which I would be asking, which obviously nobody is asking because this is a tough question, such as, the vaccine has been developed within a year, from scratch, within 1 year. What sureties can you give a mother-to-be that her baby is not going to have some genetic, physical, or mental problems as a result of this vaccine, considering that the vaccine development process took approximately 9 months from scratch, from start to finish, whereas pregnancy itself takes 9 months. And then you've got the pre-pregnancy period. So how is it possible to actually test the effects of the vaccine on a mother-to-be when the whole process would take, prior to being impregnated to after the baby is born? That process, that duration, is actually longer than the duration that it took from the vaccine to be developed. So how can they possibly guarantee, or at the very least make a would-be mother feel secure in the knowledge that this vaccine is not going to have any negative effects on her baby, when it just wasn't physically possible to test for such effects? Another thing I've noticed, and this is actually quite funny, the increasing use of the term allegedly or alleged. You've probably noticed this yourself. It's actually quite ridiculous. You will see on CCTV or on a dash cam or something, you'll actually see a criminal, some guy, for example, punching another guy in the face and knocking him out, or driving a stolen car and smashing into a number of cars. And you'll see that the news presenters are so incredibly precise that they use the words, the perpetrator allegedly hit the victim in the head, whereas it actually shows on camera that he smashed him in the head. That the criminal allegedly drove the stolen car into parked cars and allegedly caused damage, whereas on police dash cam you can see that he's driving into cars and smashing them. But they are so accurate and they are so precise that, well, we cannot say for certain, even though it's on camera, because the case has not gone to court and everyone is innocent until proven guilty. Whereas when it comes to the vaccine, and when we talk about the Therapeutic Goods Administration, they constantly talk about the vaccine being approved by the TGA, Therapeutic Goods Administration. Now, I've had a look at the Therapeutic Goods Administration website, and what do I read here? It says 25 January 2021, the Therapeutic Goods Administration, TGA, has granted provisional approval to Pfizer Australia Proprietary Limited for its COVID-19 vaccine. The key word here is provisional. That is quite different to approval. It's a little bit like a driver's license. Are you a P-plater or are you a fully licensed driver? Do you hold a provisional driver's license or a full? There is a big difference there. Otherwise, if there wouldn't be a difference, you wouldn't have P-plates. So in this case, it is provisional. In other words, it means that at the moment, in this circumstance, under this special case, the Pfizer vaccine is being approved. And then later on you will see that there are clauses here which actually says that should things happen, then that this provisional approval will be taken away. Now this is again very, very important. By using this as an argument that the TGA has approved, that basically says, well, it's been tested, thoroughly stamped, no worries at all, it's done deal, as all the other medications which are on the Australian market have been approved. It is not the same thing. It is provisional approval. Why is it that you see a guy getting punched in the face and he is allegedly being punched in the face when you can see in front of the camera, like in front of your eyes, he's been hit in the face, and that is allegedly being hit, because we need to be very precise and accurate. Whereas over here, when it comes to the approval of the vaccine, it says specifically it's been granted provisional approval. You do not ever hear the word provisional being mentioned when we talk about the actual approval of COVID-19. Very, very disgusting. It is not right. So what that means is that there is manipulation, there is media manipulation, there is media bias, and that then becomes really scary. It becomes scary because we now do not know what is being said on the media, whether that is actually truthful. So that makes things actually worse, because they might say 10 things on the media which are correct, but because you know that the 11th, 12th and 13th thing that they have said was a little bit slimy, now you don't know whether any of those 10 or 1 or 2 or 5 of those 10 things which are actually factually correct, you actually don't know whether that's correct either. So then you start to speculate. Very bad situation. So even in factual statements that they are making, they are actually creating more harm than good to the whole vaccine course, to the whole COVID-19 situation, to people's psychological well-being, to their trust, by basically being shifty, shady, and just by not being honest. It's a matter of being honest. It's honesty. By asking softball questions and obviously expecting, very convenient answers, that is simply not being honest, because either every single reporter, every single presenter, every single investigative journalist, editor is retarded, is mentally handicapped, not to be able to work out which are really, really relevant questions. So either all across the board they are in that basket, which I obviously don't think they are, or they're just dishonest. And they're basically thinking, before they are presenting their media coverage, they're filtering out questions which are inconvenient and questions which are not inconvenient. So why the hell make a presentation when you're effectively trying to create a balanced view and you're trying to provide people with truthful and realistic information, where you're not providing truthful and realistic information? Because at the end of the day, regardless of what questions they ask the experts, the answers are going to be positive and comforting and convenient for the COVID-19 vaccine agenda. So business crew, please take that into consideration. I mean, you probably noticed it anyway, but I've just given you specific examples. So if you do have the opportunity to ask somebody from the media, or somebody, if you've got access to somebody who is actually in a position of authority or power, or somebody who's higher up and actually has some power, has a stake in this, ask them these questions. How do we know the impact of this vaccine on mothers and their babies if the duration of becoming a mother and giving birth is actually longer than the period of time taken to develop this vaccine from scratch? How could tests have been undertaken in a period shorter than the actual period needed to test the actual effects on the mothers and their baby? Now, this is an incredibly important question, because this question impacts every single female who is thinking of having a baby. The next question: if everything is so great with this vaccine, why is it that the vaccine manufacturers have been given an exemption from legal liability should anything ever happen? Why is that? Considering that these manufacturers have the protection of insurance companies anyway, that these vaccine manufacturers are multi-billion-dollar companies. So even if, and this can happen with any product, because there are exceptions, there are extremes. With anything, there could be side effects. So it's almost guaranteed that if you have a large organization, McDonald's, a Coca-Cola, whatever it may be, Pfizer in this case, Ford, whatever, someone somewhere will take you to court for something. But these organizations are so large, they are so cashed up, that they can handle a payout of 1 million, or 2 million, 5 million, 10 million, 300 million even. Pfizer and the other pharmaceuticals that are making the current vaccines, and they will be making future vaccines, these are multi-billion-dollar companies. If they are being exempt, that means they are being protected against legal liability, which is going to be more than they can handle. So therefore, someone somewhere has taken into consideration that there could be major consequences which could cause a lot of problems in terms of monetary value. So how could you at the same time pretty much guarantee that this vaccine is safe? It doesn't make sense to me. On the one hand, we're dealing with such a safe product. On the other hand, you are taking into consideration that the company may potentially be liable for billions of dollars. It seems that insurance companies wouldn't want to insure these manufacturers, because at the end of the day, the company itself probably wouldn't be paying for all these damages, as probably other companies that have been taken to court don't actually pay damages. The insurance companies do, through things like public liability insurance and so forth. So someone somewhere here doesn't want to hold this very hot potato. Why? If we are constantly told that this vaccine is safe and we have nothing to worry about. That is my question. Why? That is a question that you're not going to be hearing on the news, and that is a question I have not had an answer to from anybody in power and authority. Another question to ask people in the media: why do you keep saying that the TGA, the Therapeutic Goods Administration, has given approval to the Pfizer vaccine when in reality they have given provisional approval? Is provisional approval the same as approval? If it's not, why then would you insert the term provisional in the statement which is found on the Therapeutic Goods Administration website? If provisional approval is different to approval by itself, why does nobody in the media mention the word provisional? Is this an oversight in all cases by everybody involved, or is there another reason for ignoring the term provisional when that is clearly what type of approval is given to the vaccines that are being rolled out in Australia? That's another question which I think is a little bit tricky to answer. Like, seriously, sometimes I think that the media is just taking the piss. It's just an insult. Well, to me anyway. I remember there was one interview that I watched recently in regards to the rollout, and there was one woman explaining how people, don't need to have concerns about the pain that's involved in taking a jab, and how they shouldn't worry. It's as if that's the main issue. It's as if some people who are concerned about the vaccine are worried. Their main concern is, I don't know about this vaccine because if maybe it hurts. And they spent about 2 minutes, which is actually a long time in a 5-minute segment, talking about how how the pain is not that bad. It only lasts for a couple of seconds. It's the same sort of pain you get from any other. Just ridiculous, just crap. Another example of softball, softball sort of questions, softball, answers. Just ridiculous. But there is something that you can do to get a little bit of payback with the media, and this is going back to taking the piss out of us, which is really annoying with some of these media outlets, particularly on YouTube, that they are disabling comments. They're projecting this crap. In a lot of cases, it's crap. Yes, there is some factual information, but there's also a lot of crap, a lot of bias, and a lot of softball, really fairy floss material out there, which is not really of concern to us, and it's certainly not helpful to us in making a reasonable judgment and an informed judgment about the true costs and benefits of these vaccines. If you want to get a little bit of payback, if you feel insulted, then what I do is, with the news channels that have comments turned off, I delete them from my recommended channels. I do watch the news. I do a lot of research. I need information. The good news is, because Channel 7, Channel 9, Channel 10, the news is pretty much the same either way. Your black gangs, beating people up, and obviously they don't mention that they're black. And now the vaccine rollout, you hear about it on 50 different channels, and it's all positive, and it's all pretty much the same thing. Okay, same thing, same approach, same attitude, same style, same agenda, same objectives. But some, particularly Channel 7, allows comments, allows people to comment and have a dialogue and just discuss things, argue, whatever. But most of them don't. Sky News, again, it is another channel that allows comments, and that's really good. I mean, I have issues with Sky Channel in other areas. But they're good in that respect, and Channel 7 is good. So what I have done is I don't watch, for example, Channel 9 or A Current Affair, which actually hurts me a lot, or even 60 Minutes, because these are actually really good programs, but I have actually disabled them from my recommended, because if they consider me to be inappropriate, I don't know, maybe, too dumb or too unworthy to hear my comments or to allow me to make an input, well then, I must be, by default, unworthy or too dumb to watch their content. Either that, or they think that they have total authority over me to dictate what I can listen to, that I'm simply, in their eyes, a receptor, and I don't need to create any dialogue. It's just one-way traffic where they project the message to me and I have to absorb it. Well, I find that insulting. I mean, not realistically insulting, because, I'm not one of those guys who gets insulted things, but, I that pisses me off. Okay, sorry. I find that to be annoying, and I find it to be pissing me off. And as a result, I then, delete them. They've deleted me effectively from my commentary, so I delete them. So what I ask of you is that if you accept what I'm saying, if what I'm saying makes sense, then I would recommend you to delete their recommendations from your YouTube channel. Now, the media is copying it pretty sweet at the moment. Their physical, newspapers and magazines, well, no one's really buying those. Well, not no one. Very few people are buying those. They're making losses on those. Now they've got issues with Facebook, and they've been they've been deleted from Facebook. As well, and so they're really running out of wiggle room. And at the end of the day, we are giving them money, because every time we watch them, they get money, really. So they should, like all other organizations out there, should, at least consider us, our views and our opinions, and, they shouldn't just be real cocks and just, treat us like morons. And as a result, if we then move over and, just switch our view to, for example, Channel 7, and then, channels like Channel 9 or, ABC, whatever, if they lose their eyeballs on YouTube, well, they're going to lose revenue there, which is probably one of the few places will actually make a profit. Then they are going to start to consider things, a little bit more seriously, I think. So please, because I can't do it, 5 people can't do it, 10 people can't do it, 20 people can't do it, it's not going to make a difference. But in this case, if, there are thousands and tens of thousands of us making the switch, and it's very, very easy, like, you've not lost nothing. Whether you hear about, the black gangs beating people up in St Kilda, whether you hear about that on Channel 9 or Channel 7, it doesn't make a difference. But it does make a difference in that if you watch Channel 7, you're kind of supporting them, because they're allowing you to make comments, and they're allowing you to create a dialogue and a conversation. And you're still getting the news, actually, and you're ignoring Channel 9, just like Channel 9 is literally ignoring you, basically saying, shut up, sit down, shut up, watch. We don't care what you're thinking, what you want to say. If you want to say to them, well, no, you shut up, we don't want to hear what you have to say, then swap over, to Sky News or Channel 7. Well, business crew, it's time to sum up this very long and detailed podcast. If you have reached up to this point, then, well, congratulations, and you're obviously interested in this topic. So just to summarize everything and to prepare the ground for the next podcast, the very bad news is that the conspiracy theorists, in the case of COVID-19, are our leaders. This is very, very sad. This is very scary, because they have an enormous influence over us, over our lives, over our perceptions of things, over our understanding, over our values, over our education levels, over our health system, over a lot of things. So if you find that the people who have so much influence on you are the ones who are not acting rationally and have ulterior motives, then, well, I've said it before, I'll say it again, Australia, we have a problem. We have been told that the coronavirus, or specifically COVID-19, is deadly, it's a killer, it's something that we need to be incredibly careful about, it's something that's a danger to our society, to our lives, to our health, to everything that we do, to our loved ones, to our hated ones, to everybody in between. Perhaps maybe not our pets, but that's about it. And we have been forced through fines, through threats, through curfews, through lockdowns to alter our way of life. The reality has been, as a result of deeper research and analysis, that in fact the COVID-19 virus is highly contagious, but it is actually incredibly weak. It is only a serious threat to an incredibly small proportion of our population and to a very specific segment of our population which already has pre-existing conditions, which changes things completely around. The attention and the force and the money that has been put behind the battle with this virus is significantly disproportionate to the reality. As a result, the only thing we can conclude is that we are dealing with conspiracy theorists. We are dealing with dishonest agents, and that is something that is incredibly scary. And the media, who should be providing us with information and potentially guidance, unfortunately has not been doing so. In this case, we can't trust the media, and unfortunately we can't trust the leadership, which means we are now left for ourselves, by ourselves, to try to manage our way through this mess. So that's pretty much what the focus of this podcast has been. Next podcast is going to be hopefully equally interesting, and hopefully you are going to find out as much new information and gain as much knowledge as you have in this podcast. I certainly hope that you have learned something. I hope that I have steered you in a direction for you to do your own research and to substantiate and to confirm my findings, and you can obviously do that in your own time, and you now know what sort of information to look for. So in the next podcast, I'm going to be reviewing what I have witnessed over the past year in terms of government actions that have been implemented economy-wide, nationwide, Australia-wide, in regards to combating COVID-19. I will show you that the government responses have been disproportionate. I will also show you and give you specific examples of how there have been inconsistencies in their actions and how a lot of their actions and policies have been illogical, don't make sense. And I'm finally going to present to you a conclusion why I believe the government has acted in the way that it has. That conclusion is going to be based on the evidence. There is a certain amount of speculation involved, so it's certainly not going to be definitive, but I will present to you a case why I think that this whole mess that we're in, why it is the way that it is, and what has been the incentive to do so.